First of all, I'd like to report that we had 863 locally acquired cases of COVID to 8 p.m. last night. That was out of a very substantial number of tests, 132,279 tests. And I thank the community again for coming out in such great numbers for testing, and we need to keep that up. Although we can see the end is getting closer, we're still in a situation where we need to be concerned about COVID across New South Wales. And definitely, if you've got any symptoms at all, go and get tested. Vaccination rates are doing very well in New South Wales. Right across New South Wales, we have 85.7% of the population over the age of 16 who have received a first dose of the vaccine, and 60.4% are fully vaccinated. So again, thank you to the community who understands the need to be vaccinated in a pandemic. The way out of this, the way to keep your family, the way to keep you, the way to keep our community safe is to go and get vaccinated. Sadly, we had 7 people pass away to 8 p.m. last night. There were 4 women and 3 men. On behalf of the government, on behalf of the community more broadly, and of course New South Wales Health, I extend my condolences to each one of those people's families and their friends. It's very tough when we have anyone that's close to us passes away, and these families would now be suffering that, so we're thinking of you. That takes us to 316 COVID-related deaths in New South Wales since the 16th of June. And I want to emphasise again, I hear conversations now that we don't need to get vaccinated. Well, yes, you do. You need to get vaccinated. You need to go and get vaccinated as quickly as possible. You're kidding yourself if you think you don't need to get vaccinated, because it may well be you that gets the virus and dies, or ends up in a hospital ICU. It may be you that passes on the virus to your family or your friends and sees the responsibility then fall upon your shoulders for the death of one of your close friends or family. You need to get vaccinated. Stop kidding yourself, you need to get vaccinated. As life gets a little better, I'm very pleased to say that one of the services I think that we were all very concerned had to be wound back to access more staff is now coming back online, and that is Breast Screen New South Wales. There is nothing more important than having breast screen services available for women to be able to make sure that they are addressing those concerns of cancer. And today, Sarah McGill, as I said, the Acting Chief Executive of the Cancer Institute, will give us some commentary about that. I want to also indicate some good news, some more good news, and that is that whilst we've currently got Byron, Shire and Tweed in lockdown, at the end of the 7-day period, each one of those areas will be coming out of lockdown. So thank you to the community in those 2 areas who have complied with the directions in regard to the lockdown. And thankfully we've had no further cases of concern. And so the public health team have advised that they can come out of lockdown. I should indicate though that the public health team is looking very closely at 3 areas that might have to be, well, are being considered bluntly for lockdown, but there's still a little more work to do. But I'll get Dr. Gale to address those issues, but Port Macquarie is one of those areas. Kempsey might have an extension, and Muswellbrook is also being considered as a result of cases in those areas. So these decisions are not made lightly. There's more work to do, and the public health team will be doing that work this afternoon, but I'm just putting the community on notice that there may be a further announcement today in regard to all 3 of those areas, or any one of those 3 areas. We just need to make some final decisions on that. But in the meantime, my strong advice as Health Minister to all of the residents in those areas is to be very cautious where you're moving around at the moment, and to certainly go out and get vaccinated. What we do know, vaccinations work. Vaccinations keep people out of hospital and hopefully not dying. Obviously, if you've got other underlying health issues, that can still be a challenge, a big challenge. But essentially, vaccines are what is saving the world from this pandemic. So please go and get vaccinated as quickly as you can in those areas.